You're thinking about having stem cell therapy, or you've had stem cell therapy and you're wondering, when should I start physical therapy? That's what I'm going to be covering inside this video. My name is Dr. Garcia. I'm a leading expert in stem cell recovery. I'm excited to help you heal faster and properly after stem cell therapy. When we look at the timelines for stem cell therapy, there's ideal and there's not ideal. Today I'm going to be sharing what's ideal. This might not work for you. Maybe you're too late along the process, but I'm going to tell you, if you're considering stem cell therapy, here's what we'd highly recommend after seeing hundreds of stem cell clients all over the world that have achieved fantastic results. Here is what I would recommend. Most people put a lot of thought and effort into the stem cell therapy itself, all the injections, the process, you've researched it, this is the decision that you've gone through. That's fantastic. Now the question is, when do you start the recovery process? And most people think, well, I'll wait till I get my injections and I'll worry about that problem later. And when in reality, what we see, the most successful clients who have the best results, the least amount of flare-ups, the best long-term outcomes, and the best satisfactions are those that follow this guideline that I'm about to provide today. So when we look at the actual timeline of recovery, I've gone over this on several videos, but most of the time people recover around that 6-month mark. They're starting to feel better and getting back to those activities. That's assuming they don't have a second round of injections. So if we look at how do we maximize those first 6 months, it all starts with the beginning, how you approach your physical therapy right from the get-go. In the ideal scenario, what we have is we have a lot of clients who call us who are interested in the recovery process, but they're 2, 3, 4, 5 weeks in and they're like, where do I start? When do I start? And once we start telling them these things, they say, I wish I knew sooner. So when's the ideal time to start? It's actually before you actually get your first round of injections. And what we'll do is I'll walk you through what that looks like. If you're interested in finding a provider, I've done several videos on who to look for and what type of credentials that person might have. But what you want to do is, before you have your injection, or maybe you have your injection scheduled, what you're going to do is you're going to meet with a recovery specialist, your local physical therapist, a virtual consultation. You're going to do that before you have the injections. And here's why. What happens is most people get lost in the symptoms. They think, oh my goodness, this is worse than I thought, this is tougher than I thought, this is easier than I thought, and so they go based on their feeling. What we would outline is how exactly you're going to feel before the injection, so you know what to expect. That's the best thing you can do for yourself, is have a better expectation of what this procedure is going to be like and what the recovery process is going to be like. We'll walk you through that, have an understanding of what the expectation is for the time of injections, and if you're getting stem cells through an IV, that recovery process in those first 2 weeks, you're not doing much. You're not walking on a treadmill, you're not walking and doing hikes, you're not doing anything other than your normal daily activities, which would be work and just your things around the house. In those 2 weeks, you're not seeing a physical therapist, but you can have is a appointment set up at the exact 2-week mark so you can start that process towards better recovery. So an ideal scenario, it would be before you have stem cells, and then at the 14-day mark after you receive the injections. Now, why? The first appointment is set up so that you know what's going to happen, what to expect, how to properly equip yourself, because here's the worst case scenario. We have people who go through this process, they have injections, they go about their daily life, they go back to the gym, and they go back to yoga, Pilates, whatever it is that they loved, because they didn't know. Well, what ends up happening is they have flare-ups in those first 2 weeks. They feel worse, they don't know what to do, they're concerned. And that could have all been prevented if you had a session beforehand to set those expectations, to give you the guidelines and what we call bumpers. Don't go too far right, don't go too far left, kind of stay in this lane. That helps you, give you clarity, so you don't think that you're going crazy or you have all these new symptoms that you think, well, I messed up this great investment for myself and my health. What we're trying to do is prevent that. So to avoid flare-ups and messing up what you've invested in, we want to give you those guidelines and bumpers so that your first 2 weeks are successful, so that when you come back on your day 14, you're set up for success, all your questions have been answered, and now you come back with no flare-ups, you maximize your healing, and you start above everyone else that might have had stem cell injections at the same time. So to maximize your healing, have less flare-ups, better satisfaction and better long-term outcomes, the best time to do is before stem cells and at day 14. Then the road to recovery starts, and every single time that you see your physical therapist or your recovery specialist after that should be an anchor point to tell you what the next step is. But ultimately, you need to start at a higher platform with less flare-ups, and doing it this strategically this way will help you with long-term success. If you do not, you will start with flare-ups and below everyone else, and all that does is extend your timeline and the potential to ruin your investment, and that's not what we want. So if you're worried about, well, I don't know, maybe I'm too far along, did I make it worse? If that's a concern for you, we do offer a virtual consultation for anybody. We call it our stem cell recovery assessment, if that's a concern for you. If you're ahead of the game and you're thinking about doing stem cells and having the injections, this is the place to start. Contact us. We can help you with any questions to set you on the right pace. If you're farther along and you're concerned, also reach out to us. We'd be happy to help. Or your local physical therapist, if they have those qualifications and they're certified and they're able to help people like yourself, that's fantastic. In either case, you just want to get the help that you need, and these are the criteria to set you up for success. So if you have any questions, feel free to give us a call, send us an email. We'll be happy to help. Enjoy. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on recovering safely to create long-lasting results after stem cell therapy. Thanks, and I'll see you soon.